Housing associations house about 6 million people. Where are they going to go if we don't do that? That's not our job. Someone else will sort out these challenges. Problems that one family is experiencing can actually become the problems for a whole range of families who desperately need good quality, affordable homes. Their lives would have been considerably worse off. We've cut this down to the bone. We build about 1,200 new homes a year. I fear that we're getting to the end of that resilience. The long tail benefits would be enormous.
Voices of Care, the healthcare podcast.
Stephen, welcome to Voices of Care. Thank you very much for coming to see us today.
My pleasure. Looking forward to it.
Well, you're the first representative of the housing association sector, and I wanted to start off there, if I may, because the podcast focuses a lot on, of course, health and social care, and I think people's perceptions of housing associations tends to be affordable housing for people on lower incomes. I think it's a little bit more than that in terms of housing associations. It'd be interesting to get the gamut, because I know they've been around a long time. Mm-hmm. We don't have to go back to Cirencester and 1235, but I just wanted to get your perspective on the variety of things that housing associations do.
Okay, no problem. No pressure being the first one to talk about housing, having the weight of housing on my shoulders.
You can handle it.
But I guess some of the numbers. Housing associations house about 6 million people across the country.
About 10% of the population.
Exactly, about 10% of the population. Their history, not talking about almshouses and going back 12th and 13th
Fascinating
century,
that is,
which is a whole other discussion. Their roots were Victorian,
yeah.
So they were kind of 19th century philanthropists like George Peabody, which we'll no doubt talk about a little bit, and some others like Octavia Hill and the Guinness family, etc. If I fast forward to today, kind of modern ones, or I guess I'd probably want to say before that the big movements were that kind of philanthropic 19th century,
Mid-19th,
and then it was the kind of 1960s, Cathy Come Home, tackling homelessness.
That was a Ken Loach documentary. It became very famous over here.
Exactly. Lots of church leaders, reverends, ministers, etc., started setting up really small housing associations. Back in the day when you could just buy 10 houses on a street and put people in, because the rents for what we now call social housing wasn't any that much different from general rents.
Right.
So you could do that. So that was kind of the second
But
wave.
the driver was not so much the rents, as you say, Stephen. That's interesting. It's the church people and their volunteers wanting to clear the slums and the terrible conditions in which people lived.
Exactly. So its roots have always been kind of social and charitable in that sense, and trying to raise the quality of housing standards more generally. And probably the third wave was the kind of transfers from local authorities. So local authorities had difficulty investing in their housing, and because it was social housing, not dissimilar from housing associations in the 80s and 90s. And so one way to get more investment was to transfer those to these kind of housing associations.
And that was there was an act in 1974 that allowed public funding for social housing. In 1988, I think, allowed that big transfer. I think we ended up with 400,000 social houses being built. And you were talking about that big expansion. That's the provision of social affordable homes. But the housing association provision is much broader than that, isn't it?
Yeah, indeed. If you fast forward to now, a typical housing association will still have those social homes, so there'll be kind of sub-market rents. In London, I think the average social rent is probably about £140 a week. So you can do the maths and compare that with market rents.
Eye-watering difference.
They also do shared ownership. Mm-hmm. So if you've ever seen any of the kind of part buy, part rent schemes, housing associations tend to be the main proponents of that. They develop homes.
So this is building on their own
or
in
build
partnership?
New homes in partnership and in their own rights as developers. And the bigger ones obviously have much bigger programs of new build development, which means that they also end up managing leasehold properties. And we provide a whole range of services. So it's more than just putting a roof over people's heads. It's about some of the care and support services, which is kind of my specialist topic.
Which we're going to come on to.
But also employment opportunities for communities, access to community buildings, support for people in times of crisis, advice and well-being support. a whole range, play activities for kids, trips for older people. So we're real kind of anchors in communities, really. And to some extent, doing what local authorities used to do when they could afford to do it.
Absolutely, yeah. I think the National Housing Federation, which is the voice, I think, of the sector, talks about something like, just on the rental subsidies that you talked about, I think it saves tenants. Otherwise, they would have paid £9 billion worth of additional rent. But it's interesting you talk about the community provision and the support for people on the wider determinants of health, including loneliness.
Yeah, definitely. I think that one of the challenges is if you're housing people, particularly in a Peabody context or a big housing association context where you've got estates, when you're housing 600, 800, 900 people in the same place, it doesn't suffice to just put a roof over their heads, because the problems that one family is experiencing can actually become the problems for a whole range of families. So you can't stand back and say, that's not our job. Someone else will sort out these challenges. It isn't our job to sort out the challenge, but it is our job to support people to find the help that they need, whether that's in the health service or voluntary sector specialist or whatever it happens to be.
Great.
So I was just going to say, you can do that through kind of mission creep. So it's not your intention, but you find yourself having to do it in a kind of unstrategic way. Or you can just grasp the nettle and understand that you have these responsibilities conferred on you and try to do it in a more organized way.
Absolutely. And I wanted to, you've talked about, obviously, Peabody. So let's focus on Peabody itself now. Hate to remind you, I think it's 27 years since you joined a very different organisation. Back then, you've been a director for nearly 20 years, since 2006. Give us an idea around Peabody. It's got a very venerated history. The philanthropist, 1862, I think.
Indeed.
£500,000 settlement.
You seem to know an awful lot about it, and you also managed to slip in that I'm a Peabody lifer.
It's a brilliant 27 years.
27 years in. So yeah, Peabody was one of those philanthropic organizations set up by George Peabody. He was an American banker who made a lot of his wealth in London, working in banking. As he got to the latter part of his life, he invested in lots of things. He gave his money, most of his money away. I like to tell people that Bill Gates is the George Peabody of his day.
I was just going to say, yeah, absolutely.
Really. But one of the things he did in London was he did, through kind of 3 separate chunks of money, give $500,000 to what he said then was to ameliorate the conditions of the poor and needy in this great metropolis.
Amazing. Yeah.
And that was the core of Peabody. If you fast forward that to now, through a series of developing our own homes, through mergers and acquisitions of other properties and consolidation that's happened in the sector, we now have about 108 to 110,000 homes. Because we're developing, the number goes up.
Yeah, of course.
All the time. So say 108,000 homes. We've got a care and support business, which I run. We've got 2 property companies that do kind of property maintenance, because we invest about 40% of all of the rents directly into the repairs and maintenance of those homes. We build about 1,200 new homes a year. And we provide a range of services. We invest about £8 million in our community foundation, which provides a whole range of kind of non-housing support for residents.
And you've got something like, is it 200,000 residents you're supporting?
Oh,
something
gosh,
like,
about 220,000 residents. I think that if you get on a tube anywhere, you're most likely to find a Peabody resident in virtually every carriage that you.
I came in via Thamesmead this morning driving, so I think that's one of your very
largest.
Well,
you would have most definitely had lots of Peabody residents. We through a merger that we did back in 2013, we took over a community development trust, a housing association, and a property company. So Thamesmead in Southeast London, we own about a third of it. So we own about 5 lakes, 7 kilometers of canals, 30,000 trees and several hectares of open space. and about 6,000 properties there. And we've got a big redevelopment program of rebuilding some of the older homes as well as building kind of new homes.
Yeah, we'll come back to that, but it's exciting potentially, provided the DLR line can get into the right place.
We're certainly working with the government to get to open up transport access. So there's been Elizabeth Line at one part of
Big fan of the Elizabeth Line. It's transformed.
It's incredible. But we need the Docklands Light Rail at the top end so that we can kind of open that up for up to 20,000 more homes.
Amazing.
And again, we've got a big community program there as well. We've got a football stadium, if you can believe it.
Oh, I haven't seen that.
That used to house Thamesmead Town Football Club.
Wow.
We've got a big youth center there. We've got a number of facilities that we rent out at low markets for local community groups as well as some of our kind of supported housing schemes, which I'm sure we'll talk about in the not too distant future.
No, we'll get there. I wanted to just tarry there because that's a really good example, Thamesmead, in terms of social regeneration, contributing to communities and to economic development. And if I may, before we go into your section of the business, which is really powerful and directly relevant to healthcare, it's interesting. We're now the government has a very clear mission it's set for its economic growth, but also for new building. And there is a housing crisis, and analysts and commentators have said that housing associations, in a sense, are almost uniquely placed to make a contribution to that. And the National Housing Federation says you could build 90,000 homes and 140,000 new jobs, £51 billion of economic value add. Are you excited about that? Because the potential for housing associations to help the government in its bigger plan of 1.5 million homes?
I'm cautiously excited, if one can be those two things, if that's not a contradiction in terms. I mean, on the one hand, housing associations are the biggest providers of social housing in the country. So if you want to build more homes, you need us to be part of that equation, and we need to want to be part of that equation as well. But by the same token, we're under huge amounts of pressure to invest in our existing homes, to deal with lots of the new regulation, to kind of absorb all of the inflation in housing of late. And to just prioritizing kind of existing residents and their needs over kind of future residents. So we're having to kind of deal with that conundrum of dealing with, we know that there are thousands of people in temporary accommodation now who desperately need good quality, affordable homes. But by the same token, we've got aging stock that we need to invest in. So existing residents have good quality homes too.
Now that's interesting because I think the numbers show there's, according to the National Housing Federation, something like 4.2 million additional people could benefit from affordable housing, 160,000 children living in temporary accommodation. You referred to that. Is it a question of, because the atmosphere has changed, the macroeconomic environment is very different. You talked earlier about that phase of housing associations in the 70s, which exploded the stock because you were able to have public funding to create social housing. Now, I think in 2010, if I'm right, that funding was reduced significantly. So that's what's putting the added pressure of your ability to build houses.
Oh, don't remind me. That's a painful period for me, Suhail. I had a brief stint of 4 years as running our development department.
I'm sorry, I didn't realize that.
Yeah, and I started in 2009, just before they cut the grant levels. About a year later. So yes, the level. I guess the wider context is that if you build a property, it costs you the same to build that property, whether I'm building it for you to come and buy it for $500,000 or for me to rent it for £150 a week.
Yep.
The house will be no cheaper or more expensive depending on the person that uses it. So the only way you can make it work if you want to do it at a sub-market level is that it requires some subsidies. Some money's got to come in from someplace else to make the numbers stack. So that's what we mean when we talk about grant and the government's kind of housing program. It's providing that subsidy for those low-cost homes. And so what happened in 2010 is that the levels of grant went from something like 50% of the cost of building the unit to more like 10 to 20%.
Massive reduction.
Massive reduction. So what housing associations subsequently had to do to address that was they had to leverage the asset base that they already had. So borrowing against the existing homes that they had in order to put more into the equation, because we wanted to build these desperately needed homes. But obviously there's a limit to your capacity to be able to borrow to build these homes. Alongside that, we've had some cuts to our ability to raise our income, to raise our rent. Because
that's capped, isn't it?
Exactly. There's a formula that determines the rents. And for a 4-year period, the government created a formula that reduced the level. We had to reduce by 1% every year the level of rents. And if you look at that over 4 years and then prorate it out for 20 or 30 years, you end up with a huge gap in your income that you anticipated you'd need. But actually, your repair bills do not go down.
No, it's
your
interesting.
Costs don't drop anywhere.
No.
So you end up with this wedge of unfunded activity, which is and now we're in that place when people are in, all these pressures we've talked about, all these people in temporary accommodation, the government's desire to build 1.5 million homes over a 5-year period. How do we square that circle?
Because I think it's interesting you mentioned that if they put the cap in on the rent, they've reduced the subsidy, if you want to call it that. And I think the National Housing Federation number is a staggering number. I think that all members of the Federation, I think, spending something like £88 billion on maintenance. So they've called for some measures from the government. What would you like to see? Presumably that pared back and a more favourable rental cap?
Yeah, I mean, I think we all have to be realistic that there is no magic wand. The government does not have a magic money tree, to go back to a previous prime minister's phrase. And so I think we all have to be pragmatic and be positive about what we actually can do and what would be a sensible way to go forward. So, So I would hesitate from saying, well, just give us more money and everything will be fine. I think there are some things that can be done to deal with parts of the problem. One is certainty about what the rent levels are going to be. Because we're developing for the long term. We're managing these units for the long term. So we have to have some certainty that we can afford them in perpetuity, really. So if we could have a 10-year rent settlement, say, instead of more shorter term ones, that would give us a bit of stability in our
and build a business plan accordingly.
Exactly. And similarly, if we had some support for some of the new regulations, for example, around cladding of tall buildings post Grenfell.
Of course.
The awful fire in, I think it was 2017.
2017, yes.
And which is costing us millions of pounds to rectify, with little or no support for that. So that's just coming out of the kind of core business. And similarly, there are other regulations that are pushing up costs as well. So if we could just get some support in those kind of key areas, it helps us essentially recapitalize the business, ours and the wider sector, so we can help with some of those challenging numbers, really.
Well, it's a big mission for the government, so hopefully anyone listening, they might be able to see that there's a strong advocacy for the role of housing associations. Moving away from the broader property and development side, which is really important, I think, on a social perspective. I wanted to zero in on your area of expertise and leadership at Peabody, which is in the care and support division. And it's probably still not well known how broad the support that housing associations bring. But perhaps you can put some context at Peabody. I think something like 1,100 staff you're in charge of, and quite a large 70 odd million pound of turnover. It's a lot of people devoted to that care and support function.
Yes, it is. Peabody we've always been kind of committed to working in communities and housing people who need housing in that community. And if you think about it in a holistic way, you will necessarily house people that need more support than others. Some won't need any support other than a house that they can afford. Others may need a house with some support, and that support can kind of vary. And so we've stepped into that space. So now we've got about 7,000 of those 108,000 homes are specialist properties.
Right.
And that's a range of specialisms for homeless people with learning disabilities, people with mental health problems, older people who want to live in a supported housing environment. people fleeing domestic violence. There's such a range of different schemes. We do some hospital step down services as well, so hospital discharge and the like. And we do some kind of traditional care, even though that's not the biggest bit. But as you will know, it's actually quite staff intensive. So the numbers are, we actually turn over something, the numbers vary depending on the contracts, but between kind of 70 and 90 million pounds is the size of that business. We have about 1,100 people, and that's operating with a high number of vacancies because of some of the recruitment challenges. So I think if we had our head count, we'd probably be closer to 1,200.
Right.
Operating in London and the Southeast, particularly big levels of provision in Essex and Hertfordshire and a number of the London boroughs.
And in terms of the people that you contract with, so this is right across the public sector, that would be local authorities, NHS?
It is. It's overwhelmingly local authorities. Local authorities are the primary commissioners. There are some more complex relationships where the NHS and the local authority are both kind of co-funding some stuff. And then there's some others where it's more directly between ourselves and the NHS. And if you've been around as long as Peabody, you'll also have a whole range of ridiculously complicated arrangements where the NHS gifted us some land in 1970 something to do something, and it can only be used for that purpose.
Right.
So they still get the benefit out of it in perpetuity, essentially.
And in terms of that, you touched upon it briefly, but if you expand a little bit, you're covering support for people with mental health and learning disabilities. And when it comes to supported and sheltered housing, I mean, housing associations are the largest provider, aren't they?
Yeah. Oh, most definitely. Yeah, we're undoubtedly the largest provider of that housing. Peabody provides about 2,000 properties for older residents in the specialist provision. And older people live in all of our
Many
housing.
different, yeah, of course.
But these that have more intensive housing management, we've got about 2,000 of those units. I mean, I think that we do lots of really good things, and that's absolutely fantastic. I think the things that I'm probably the most proud of is firstly the workforce.
Yep.
People come to work in care and support because they care about other people, not just because they want to get paid, because frankly, they're not the best paid people. There are lots of other things they could do and earn similar salaries. So it really is a vocation. It's not a job. So we've got some fantastic people who kind of show up. We've got some incredible residents who just want to live their lives as well as they can. And some of them only need a little bit of support to be able to do that. And we've got some really good satisfaction levels. Our resident satisfaction and care support, ranges from the lows in the mid 80s to the highs of the low 90s. And I'm always trying to push up into the 90s and away from the mid 80s. But actually, those are pretty good numbers.
They're good numbers, and I think for mental health, it's over 80% of those, which has been I think your recent survey. To focus on that a little bit, because what's interesting there, the workforce, you alluded to earlier, I'm taking social care as a broad umbrella term. I know you provide a myriad of services, but certainly in social care, Skills for Care, etc., has provided stats of significant vacancies and difficulties in terms of recruitment. How have you sought to combat that? That's tough because you're presumably under the same funding pressures when you're working with local authorities who commission the support.
Yeah. Oh, it's been a difficult 15 years. Yes. I mean, the sector is so incredibly resilient that I think it gets taken for granted. Actually, I fear that we're getting to the end of that resilience. I think I read somewhere that the charity sector more broadly than just social care has essentially funded kind of government funding gaps to the tune of almost £4 billion. And they pretty much exhausted their reserves and their ability to do that. And we're kind of victims to some extent of that as well. We, along with the 170 organizations in the National Housing Federation, recently submitted a letter to the Prime Minister and the Chancellor, essentially saying, these services are at crisis point. You're already losing services and the homes that go with it. We're not building any to replace it. And 1 in 3 of all care providers and social care providers more broadly are talking about reducing services or exiting the sector, entirely. And we've asked that the sector get at least £1.6 billion to try to reverse, what has been essentially 15 years of cuts or standing still while inflation has been going up and needs have been going up as well. So it's quite difficult. And for Peabody alone, this year is the no one in Peabody probably thank me for this, but this is the first year that we've had a deficit budget for our contracted side of the business. Typically we're looking for margins of 2%, 3%. Wow. Of course, I mean that's the nature of the. If you can get to 5%, it's exceptional. So that and you can then start to invest in the technology and drive service improvements. But we work to a 2% margin over the length of a contract. We're going to lose 2% this year. We're working to claw it back and ensure we've got a viable business going forward, because that's clearly unsustainable. But the increases to national insurance, along with the pressure on the kind of commissioner's ability to give uplifts on those contracts, has really put us in a difficult situation that we can't sustain.
And it's interesting that you made that advocacy and the extent that the department of business that you run. I'm reminded. Back in 2017, the Grenfell, we all, of course, remember that very, very well. And in the light of Grenfell, Sajid Javid, then Communities Minister, I think commissioned a green paper. And when he was into this whole situation, and I remember him saying that we must return to a time where housing associations, and I think he used the word, were treasured. And I found that interesting. That's 8 years ago. We're a different place, different government. It seems to be a long way from the housing associations being treasured, from what you're saying.
Yeah, I think that's true, and I think it's true in lots of regards. I think local authorities, they can't give you what they don't have.
Yep.
They've had huge cuts, and so I'm hugely sympathetic to kind of where they are. And I think we and they try to make the best out of the resources that are available. And similarly, central government's had its own challenges as well. But we as the front-facing end of that business, get all the flack from residents about all the things that we can't do, which makes it quite difficult. So I spend a lot of my time actually going out to schemes, going out on housing estates, meeting with residents, looking at their properties, so that I can see some of the positive as well. Because if you just sit in your office, sit in your ivory tower, all you get is the negativity, the things that haven't worked, and you get no sense of what works really, really well, the fantastic work that people are doing on the ground, and the residents that are actually pretty content.
And that's the dissonance between being on the ground and these negative. We're going to come back to that, because I think it's a good space to really set out what you want from the government a little bit more, because I think at the moment the timing is important for social care. We've got loads of changes. We've got an NHS 10-year plan. We've obviously got Social Care Casey Commission. We've got government initiatives around immigration, all of which will impact the workforce challenges. But going to the positives, maybe one of the cases which I found fascinating looking at the work of Peabody and the housing associations is that to flip the argument from this is what the cost of this is, to look at the contribution, and maybe you can bring that to life. So for example, I think you've done the stats are 1 in 7, earlier this year, 1 in 7 people in a hospital bed are really waiting to be discharged to a social care setting, however widely we define that. I think bring to life a little bit, because I think Peabody has done some really interesting work, value for money work, in the hospital discharge space.
Yeah, I mean, I think there's two things around that. One is on that kind of specific acute issue of kind of bed blocking, to use the kind of vernacular that's kind of in the public space. We have moved into some of the hospital discharge services, particularly in some areas of London where it's quite acute. And there's some scope for us increasing that as well. I mean, one of the pinch points in doing that is that there's not a lot of new development. So we're not building new homes that we then use for these schemes. So we're having to convert existing buildings, existing properties, which means it can be timely and costly just to get it off the ground. And so you need a pretty long runway to create the kind of capacity that the NHS needs. But the benefits, the financial benefits, as well as the social benefits are humongous. strongest, as you've kind of pointed out, as you've alluded to. And so there is a need to do more of that.
On the acute side,
but
yeah.
That's very much on the acute side, and one of the kind of pressures that I think the government is trying to deal with. But more broadly, if you just look at what social care providers do, when we're at our best, we're stopping people from needing those GP appointments and the emergency room treatments and spending longer in hospital because they've got a home, they've got the support that they need when they actually need it. And those costs are probably several times the kind of hospital discharge cost, really. And that's probably where the real long-term value sits, I think.
No, that's interesting, and it's been intriguing to see if that advocacy is reaching the right ears. You talked about learning disabilities. That's a very big area, large public purse commitment around there. Some of the work in Essex you talked about that you've been doing, that you're particularly proud of, supporting people with learning disabilities. Yeah,
no, we've got a very long history in doing that, and it comes from some of the legacy organizations that we merged with, and it's kind of moved over time. I mean, when it started its life, probably back in the 80s, 90s, it was mainly nurses leaving the NHS. So the quality of care and support was just absolutely incredible. And they really understood the client groups, the customers, as we now call them all, the beneficiaries, what have you. They really understood the needs. And it's an area that we sometimes talk about, the business of care and support and all of that stuff, but actually I'm always conscious that overwhelmingly most of the residents and the people that we work with in the learning disability space we're like family to them. They've lived in these places for a good chunk of their lives, and they're probably going to live there for the remainder of their lives. And so the 4, 5, 10, 12 people that work in the schemes alongside them, who help them get up in the morning, who help them eat and brush their hair and get dressed and go out to the shops or do whatever it is that they can and want to do, are like family. The bonds are so tight. So it's almost difficult. It's almost embarrassing going to commissioners and saying we're not getting funded. We're not getting enough money to deliver this stuff because we're so committed to doing the delivery. Because where are they going to go if we don't do that? And as you know, the learning disabilities can crosses over into quite complex needs very, very easily. So we learning disabilities is a catch-all for a whole range of vulnerabilities that people have. But the flip side of that being that they also have, people can live great lives in a whole range of situations, and that's what we're trying to do. What I tend to tell my staff, especially new incoming ones, is that our very first priority in care and support is to keep people safe.
Yep.
They need to be safe and they need to be secure, and that's got to be our priority. And we have to move heaven and earth to make sure that happens. But once we've got that stable base, it's to help them get the best life that they can possibly get, and whatever that means for them. And that comes through in learning disabilities in a way that it does in all the services. But when you've got young people kind of coming through and you're trying to help them, they really want access to Wi-Fi, and they want you to stop having all of these rules and the properties so they can get their friends in. And it's a little bit different. It's important, but it's very different from supporting people that that had you not supported them, their lives would have been considerably worse off than it actually was. And to get that gratitude from their families, particularly, is I still need a salary, but that's almost reward itself.
It's hugely rewarding. I can see that in the passion after 27 years that conveys that. One really wanted to finish off with effectively a platform, because for you just to wrap this and bring this together, we are at an inflection point, a seismic moment, whatever these platitudes are, with big changes in the provision for health and social care afoot. The National Housing Federation has really called on the government for a new national affordable housing programme. What does that look like? What will it mean to our society if actually they did listen to some of the demands that you've put forward?
Well, for them, I guess the upfront cost would be expensive, But the long tail benefits would be enormous, both enormous financially for the Treasury, but also enormous for society, for communities, for getting people out of temporary accommodation, for giving people the right kind of accommodation, for helping the economy by having the people who can do the jobs nearer to the jobs as well. So it's huge amounts of benefit. And I think we've already demonstrated, the value of, for every billion you put in, what you kind of get out of that in terms of results. So that almost kind of goes without saying, really. One thing I would say, and I know Baroness Casey, as you refer to, is doing the kind of social care review, is about 5 years ago, I think, I wrote a kind of an internal discussion document in Peabody about the ills of social care and how we could kind of fix them all. And if you look at my LinkedIn account, you can probably find it in one of my posts. It's quite short. I kind of write and think in bullet points. So it's only about 2 pages. It talks about all the things that kind of need to happen. So I won't rehearse those here. But most of them cost money.
Yep.
Most of them cost money. And it's not that we are always arguing for money. We're basically saying we've cut this down to the bone, and now if we want to do more, we've got to put more money into it. So it's all about resource, and it's not for me to tell the government to spend $1 billion here or $1 billion there. They need to look in the totality of all the things that need to be done and realize that they got a really precious resource, particularly with large housing associations or big support providers. Because we've got broader shoulders. So when our margins get tight, we can still provide quality support. If you're small and with 3 months of money in the bank and your commissioner doesn't give you an uplift, well, what can you do? You've got nowhere to go. You can't subsidize that. You can't cash flow it at all. You've got to cut the services. So if we're not careful, we're going to sleepwalk into services that aren't really fit for purpose. And that's just not a good place to be, really.
And one final question as we head to the next 3 years and your 30th anniversary with Peabody. What's the things that's making you particularly excited? You've talked about Thames Mead, but other things that you're involved in that you're really relishing at the moment?
I think what I'm probably most excited about for the business in general, I think I'm most excited about the real focus on residents. After all of these years, residents are still at the heart of what we're doing and what we're trying to do. We've got a number of improvement programs to try to improve our maintenance service, to try to be more responsive. There's a real challenge in getting bigger, but still being kind of local and being accessible. What residents really dislike is that I'm standing in front of them. They tell me they have a problem, and I say, oh, you have to go tell someone else because it's not my job, and it goes through this convoluted system. So we're spending the next 3 years trying to focus on how we can give those people you see the power to sort out the things that you want sorted out, preferably now. And so I'm really excited about how we can kind of do that, because I've been around long enough that I remember when we used to have estate managers or even superintendents, I think they were called in the 80s, that lived there.
Yes.
They were kind of there. And so you could go down and tell them that this was happening or that was happening or whatever it happened to be. You needed a repair done. And they were kind of right on the spot. The world of technology and improvements and call centers and all that's kind of changed that. And it's given a bit of distance between service delivery organizations and the people that they're there to serve. And so we're spending the next 3 years closing that gap and getting much closer. More specifically, in my own little patch, it all excites me, as you can probably
I can tell, yeah, it's amazing.
But we've got some real opportunities in some of our homeless provision to increase that, working with the Greater London Authority, kind of improving the kind of capital programs to unlock more homes, but also improving the support that we can give people kind of coming off the streets. I'm really keen on that, because you can see the numbers. You can see with your own eyes the numbers going up in cities like London. So being able to be part of that solution is something I'm really looking forward to.
Well, on that optimistic and inspiring note, and hopefully a call for the housing associations to be treasured, Stephen Burns, thank you so much for coming in and sharing your vision with us.
My pleasure. Thank you.
It's been a pleasure. If you've enjoyed this episode, please like, follow and subscribe wherever you receive your podcasts. And if you want to learn more about how we're truly turning the dial on health and social care, please visit newcrosshealthcare.com/voices of care. In the meantime, I'm Suhail Mirza. Thank you very much for joining us today, and I look forward to seeing you on the next episode.
Voices of Care, the healthcare podcast.